Treatment is more complicated because people can come to that diagnosis from many pathways. So people can develop ME/CFS and FM, for example, after surgery, after trauma, after environmental exposure, after infection, after prolonged sleep deprivation. For example, if you have young kids that are unwell, for example. So those people may not all respond to the same treatment. So I think the key, Leonard Jason has written about this extensively, and it's, I think, fairly widely accepted. The key is to split those conditions into subgroups of more homogeneous or similar types of people. And I think treatments are going to be coming online for subgroups, but possibly not for all.
What's the demography here for these diseases? What ages and genders and so on?
Well, it just so happens from that Canadian Statistics Canada survey, I can tell you exactly. So this is 2010. There were 439,000 people in Canada who had been diagnosed with fibromyalgia, and there were 411,000 people in Canada who had been diagnosed with chronic fatigue syndrome. And the sex or gender difference, 80% of people with fibromyalgia were women in that survey, and 66% of people with ME/CFS were women. So there's a definite female preponderance in both conditions.
Do we know, I keep running into a few men here and there who have been diagnosed, and others who, from my total lay position, seem to have something that looks like these diseases, but they tend not to go to the doctors. Men tend to tough it out and not report. Do you think that's having an effect on the data? And should men be going to their doctor with these checklists?
Yes. I mean, it clearly occurs in men and women. Children, the predominance is around middle age, in the kind of mid to late 40s. If you kind of do a bell curve on all the statistics, it's in the mid to late 40s. But it can be in children, adolescents, young, middle-aged, and elderly. And it can be in men and women. It's found in all countries around the world. That research has been done. I think it was in the 80s, there was kind of this myth out there that it was the yuppie flu, so it was somehow only found in privileged individuals, and that's really been absolutely disproven. Like all other medical conditions, it's actually more common in poor people.
What's the scuttlebutt among you about what the causes are? Is it the air? Is it our lifestyle? Is it microwaves and Wi-Fi? What are the thoughts that you're bantering about among one another?
I think the most solid area of research is the immune research. So that's the area that we know for sure is just the immune system is just not working properly in either CFS or FM. A really interesting paper was just published this month showing that the immune changes in FM are actually in the opposite direction of CFS. So people that want to throw those conditions together, we really shouldn't do that. They look different in research. And what that study showed is that people with CFS, well, they didn't study CFS. We know from other studies that people with CFS have heightened immune activation. Their immune systems are hyperactive, but very effective. We found in this new study that in FM, the opposite is true. The immune system is actually underreactive.
Oh. Now, we can't confuse these with autoimmune diseases, can we? They're not the same thing.
I think not. There is a group near Brisbane, Australia, on the Gold Coast that's doing has an autoimmune theory, and they're doing some really excellent research, and they've got very significant funding. They've opened a whole research and clinical center there. I think until that research comes out and we know more, it would be jumping the gun. Some disorders that are connected with CFS, for example, Postural orthostatic tachycardia syndrome. So that's a syndrome where you just, your heart rate goes up when you stand and you feel dizzy and unwell, and you either fall over or you have to sit down. Paper just came out literally this week showing that might have an autoimmune cause. So I don't want to dismiss the autoimmune theory, but I would say the evidence isn't quite there yet.
Okay. Is there a budget in Canada for research in this area?
Well, no.
No.
No. It's interesting that a couple other governments around the world, the Medical Research Council in the UK, and the Federal Drug Administration and the CDC in the US, and the Norwegian Health Directorate. So those three countries at the federal level have made a decision to identify ME/CFS as an area of need and to, I guess, encourage research in that area. Nothing like that has happened in Canada, and our research budget, I'm going to say it's close to zero. There might be some studies out there that I'm unaware of. I know for myself, I've done a few projects and they've all been self-funded. And that's how most of us are coping right now, to put out some data.
You're the pioneers, aren't you?
We are.
Yeah. Now there's something going on in Vancouver that is a little bit of good news, as I understand it. Can you tell me about that?
There is. The BC, British Columbia government has promised, and I think given $2 million over maybe 3 or 5 years to open a clinic called the British Columbia Complex Chronic Disease Clinic, CCDC. And you can definitely Google that and you'll pull up the webpage. Yeah. They've hired Dr. Alison Bested, who's really, I'd say, the leader in Canada in ME/CFS, so she's their new medical director.
That's great.
It's a clinic dedicated to research and clinical care for people with chronic fatigue syndrome, fibromyalgia, and chronic Lyme disease. And I talked to Dr. Bested this weekend, and she said the first patients are going to come through in about 2 weeks. And they're going to be starting to educate healthcare practitioners, because that's an integral part of their program. They know that nothing's going to change unless, people on the ground are more educated. So they're going to start that hopefully in September.
Dr. Stein, you said that the Vancouver clinic is including Lyme disease in there.
Yeah, that's right.
Why are they doing that?
Well, as many of the listeners to this video will know, the symptoms of chronic fatigue syndrome, fibromyalgia, and chronic Lyme disease overlap. And in clinical practice, that's probably one of the most difficult, what we call differential diagnoses, how to separate, do you have illness A or illness B? It's very difficult to distinguish between chronic Lyme, some types of fibromyalgia, and ME/CFS. So I think in recognition of that, the clinic has included all three, because they realize if they choose any one of those, they're going to end up looking at the other ones anyway. I think the other reason, which is a real positive reason they included Lyme, is because there's so much controversy in Canada about, does chronic Lyme exist? If it exists, what's the best way to test it, to diagnose, to prove that it exists in an individual, and then what's the best way to treat it? So I really applaud the BC government for taking this very proactive step to really address this question. And I'm hoping they're going to set, guidelines for all of Canada.
I hope so too, and it'll help then make Lyme disease more acceptable as a thing to discuss with your doctor down the line. It's not right now. Let's talk about the patient a little bit. Some of the people who are watching us talk here, I've heard some say to me that they'd rather have AIDS than FM or CFS or ME. Another say, I'd rather have cancer. What are they talking about that we need to know?
I think, I've had patients, I haven't actually had someone say they'd rather have AIDS or cancer, but I have heard many of my patients say that when they have been diagnosed with another serious medical illness, for example, cancer, the quality of care and the degree of support they get from the healthcare system is just so good. So patients with cancer, first of all, everybody believes them because they have a clear diagnosis. Everybody knows cancer is serious, so they get a lot of empathy, both from the healthcare providers, from their friends and family. People bring casseroles, without being asked. Just people try to be helpful when they know you've got a really serious problem. They get rides to appointments because there's volunteer groups that try to support cancer patients knowing that they just don't have the energy or stamina to be driving themselves around. These are all services that would be so helpful for people with CFS and FM, and they're just currently non-existent.
Let's use that opportunity then to talk about what the day in the life of if there is a typical CFS FM patient, what do they go through that makes it so difficult that results in their becoming invisible to an awful lot of the community, including maybe the medical field as well? What happens in a given day?
I would, for most of my patients, first of all, their days are quite short because they need a lot of rest and sleep. So most people get up much later in the day. It often takes them an hour or two to kind of get out of bed and get moving and kind of move on to getting breakfast and so forth. Sometimes they don't have the energy to prepare meals, so they're eating, well, let's just say maybe less healthy choices. I know you're really keen on nutrition, so this is a big issue in patients with very, very low energy. They might not have the energy to shop for the food, and they might not have the energy to prepare fresh food. And so they're using processed food or prepared foods a lot. Usually after showering, for example, a lot of people will then have to rest in a horizontal position just to kind of recover from the exertion of showering. They have to split up their tasks during the day. So say they have to do laundry, they might, do one load, put it in the machine and then rest and then wait for the beeper and then, go change loads. If they have to go up and down stairs, that's really problematic in terms of laundry. By mid-afternoon, most people are pretty much in a rest mode. We call it the puttering mode or the couch potato mode, depending on the severity. And evenings are pretty much out. So what it means is that they get really isolated because they just don't have the energy or the stamina to be able to basically keep in touch with their friends, most of whom work and most of whom have free time on evenings and weekends. So one of the real maybe hidden aspects of the illness, it's not in the diagnostic criteria, is the incredible social isolation. They're isolated because their illness doesn't allow them the energy to participate. Also, if they have chemical sensitivity, which about half of these people have, they can't actually go into the public places where maybe social events might be taking place. For example, church is really problematic. It changes everything about life. It changes your ability to work. The vast majority of my patients are not able to work or work very part-time. It changes your role in the family. You can no longer fill all of your parenting or kind of provider roles, carer roles. So it changes everything. The degree of loss and mourning that's involved with people who have ME/CFS can be astronomical.
Yeah.
It's part of what I do in my practice is to support people through that process. I think the best thing that I offer, and I guess, a lot of people are a little bit squeamish about seeing me because I am a psychiatrist and they're a bit worried I'm going to psychoanalyze them or I'm going to assume that their condition is psychological, which I'm not. For the record, I'm out there saying this is a biomedical condition primarily. But it absolutely can have very significant social and psychological ramifications or secondary events. And what I offer in my practice is groups. And so I do education groups when people first come. And people say I would say without exception, I've been doing them for 10 years. So I've had several hundred people come through the groups. Just being in a room with, say, 6 or 8 other people who have the same condition and who get it and who understand the limitations and where you don't have to justify and explain yourself. Most people say that in itself is incredibly therapeutic, apart from, of course, the excellent information that they're going to get in the group.
This is quite an undertaking for you, Dr. Stein. I know that you are suffering from a variety of aspects of these diseases. Can you talk about that and the opportunity, I suppose, it affords you in working with these patients?
Yeah, I would say it's a mixed blessing to have ME/CFS, FM, and MCS. I have all 3 conditions. I think on the one hand, it's really afforded me I'm just trying to think of the word, like cred points, right? When I see patients, they can sense within a few minutes into the interview that I get it.
It gives you the credibility they're looking for.
Exactly. Yeah. So that, I think, is almost invaluable in this field where there's so few of us that really get it.